Hi everyone, welcome back to Living Out Loud. My name is Mark Wexmonski, the geriatric nurse clinician with the Arlington Council on Aging. And today's talk will be kind of brief, just want to do a quick introduction and then talk about diabetes. But first, I wanted to welcome Nina. Nina is an intern from Regis College. She'll be helping us at the Senior Center, helping to develop a variety of different programs. So if you are down at the Senior Center and you see her, definitely say hi. And we are very appreciative to have her. Thank you, Nina.
Thank you.
So the other thing I want to talk about today is diabetes. And as we know, as we age, our risk for diabetes increases. Some of us are born with it, some of us develop it during pregnancy, and others can develop it as they age as a result to the disease process. So really just wanted to give a very brief and basic overview of diabetes so that if you had any questions, you can talk to your doctor about it or call the Senior Center, talk to me, and we can triage it and see what's going on. So diabetes simply is a metabolic disease in which the body's inability to produce any or enough insulin causing elevated or decreased levels of blood sugar in our body. As I kind of alluded to before, there's a couple different types. There's type 1 diabetes, which means you are insulin dependent pretty much oftentimes since at a young age and all the way up through the lifespan. There's type 2 diabetes, which can be diagnosed at a very young age as well, but is more typically seen with those who are older, so 40s, 50s, and oftentimes 60 and beyond. Folks can develop type 2 diabetes. And then there's gestational diabetes, which are for pregnant mothers that can develop a form of diabetes during the birthing process and can subsequently lead to diabetes in the offspring in addition to the mother itself for a period of time. So there are different types of, well, I neglected to mention the other type, which is pre-diabetes, and if you've been connecting with your doctor recently and they've done different blood tests, testing your blood sugar, and maybe you're borderline of being a type 2 diabetic, and your doctor would say you're pre-diabetic, which means if you don't change your lifestyle more readily and you're eating too much sugary foods, not getting enough exercise, that can lead to type 2 diabetes. So diabetes in terms of blood sugar regulation and how it's all, the disease process. So our body requires the use of glucose to create cellular energy, which we get from foods. And insulin is a hormone produced by the pancreas to move glucose from our bloodstream and into our cells. So those with diabetes, in terms of blood sugar regulation, have a lack or impaired ability for insulin to enter our cells, and that's either because our pancreas doesn't produce any insulin, or the pancreas doesn't produce enough insulin for the sugar to get into our cells for energy. So as a result, our blood sugar may be too low or too high, which can obviously affect how we feel, and I'll talk about the complications of that in the subsequent slides. So what are the signs and symptoms of diabetes? So again, if you're type 1, you're oftentimes diagnosed at a younger age. Type 1, again, you're readily dependent on insulin to move sugar into our cells. So you can still have these signs and symptoms, but also those who are type 2 diabetic can have these signs and symptoms as well. So excessive thirst, so it's called polyuria, which means drinking a lot. So you're continually drinking a lot of fluids and you never feel satiated with the fluids that you're consuming. You always feel kind of thirsty. Increased urination, so again, that's polyuria. Polydipsia is too much thirst. Polyuria is too much urination. So you're avoiding a lot of urine as a result of the elevated sugar that's in our bloodstream. Folks oftentimes feel fatigued. Sometimes folks have weight loss. Oftentimes folks have blurred vision, especially with those who have really elevated blood sugar levels. Increased hunger, which is called polyphagia, so eating a lot and never feeling satiated. That's because our body's ability that our body is basically telling us you're hungry because the sugar that's in our bloodstream is not getting into our cells. So we're getting different signals from different cellular processes telling us to eat more because the blood sugar is not helping us. Dry skin, and then red, swollen, and tender gums. Sometimes folks can also develop neuropathy, so numbness and tingling in our hands or feet, and poor wound healing as well is another sign and symptom. So what are the complications of diabetes? Hyperglycemia, which is an elevated blood sugar. Hypoglycemia, which is a decreased level of blood sugar. So our body operates on a set standard or a set range of a blood sugar level. Usually it's 70 to 100, 70 to 110. So if you drop below 70, you can experience signs and symptoms of a low blood sugar, versus if it's over 110, that's considered hyperglycemia, and you can develop hyperglycemic symptoms. Again, complications, neuropathy, which I talked about, which is numbness, tingling in our hands or feet. Arterial diseases, so arteriosclerosis and other cardiac impairment as a result of untreated diabetes. Kidney damage, depression, infections, and poor wound healing. And there's a link between uncontrolled blood sugars and cognitive decline. And sadly, diabetes, if not treated, and if blood sugar gets too low or too high, can lead to death. And obviously the complications as a result of diabetes, if those go untreated and unmanaged, that can lead to significant impairment and death as well. So what are the tests? How do we know? How does your doctor know that you can become a diabetic? So blood sugar monitoring. And if there's suspect or suspicion that you may be a diabetic, your doctor may say, I want you to test your blood sugar 4 times a day, maybe once a day, twice a day. That's to monitor your levels to see if you're running too high, too low, and if you may need an insulin or other type of what's called a PO, by-mouth medication. There's an A1C test, which is an average, 3 to 6 month average of your blood sugars. So when the blood in our body carries oxygen, it carries carbon dioxide, but also has sugar attached to it as well. And so if our blood sugar is really high for a long period of time, that sugar sticks to our blood cells, which is measured in the A1C test. So, if you're going to the doctor and he says, I want to test your A1C because you're pre-diabetic, that's a good marker for determining if you may need some type of medication to lower your blood sugar. Again, that's a 3 to 6 month average of your blood sugar levels. And there's other more specific tests that can be ordered by your provider, such as fasting glucose, which is basically not eating before a lab test to see what your blood sugar level would be after a period of not eating. So if we are diabetic or you're managing diabetes right now, there's a lot of things you can do. So diabetes self-management to keep the pathology under control. So carbohydrate monitoring, you're only supposed to have a certain amount of carbohydrates per meal. You can meet with a diabetic nurse educator, dietitian, sometimes your doctor to talk about what your carbohydrate intake should be. So monitoring that, monitoring portion size. Exercise, so when we exercise, our body burns sugar, so it would decrease our blood sugar level. I talked before about burning energy to make sure that our blood sugar stays within the range of 70 to 110, or if there's a range that your doctor wants you to achieve first, obviously defer to your doctor's recommendation. An important component of diabetes self-management is stress and sick time management. So when we have undue stress or we're sick, it can really elevate our blood sugars, which can lead to other complications. So being mindful about, being more diligent about testing your blood sugar and monitoring that when you're sick or overly stressed. So we actually have a diabetes self-management program at the Arlington Council on Aging. It's an evidence-based practice course developed by Stanford, administered through senior service agencies throughout Massachusetts. And Arlington is a site where we've taught this class before. So it's a 6-week session, and it's been proven to work and been quite impactful for those who are pre-diabetic, who want to learn more about diabetes, who are type 2, who are type 1. And it's pretty intensive in the sense that we could do meal planning, we talk about label reading, there's an exercise component, we talk about depression and stress management. Individuals set goals for the week, and we try to achieve those goals, and the group works together to help each other overcome barriers if there's an issue with overcoming that goal from the previous week. So we can administer it as well at the Senior Center, but also at Minuteman Senior Services and other community agencies as well. So if you're interested in the Diabetes Self-Management Program, it's a free program. You get book, you get a resource manual. There's oftentimes a light cooking demonstration. So definitely check in with the Senior Center, the Council on Aging, me, myself, and can direct you to that program or let you know when we're running it at the Senior Center as well. So again, diabetes, it can affect folks from the young age all the way up into to the elderly. Very significant disease if it's not treated. Talk to your doctor if you're experiencing the signs and symptoms I mentioned before, or if you have questions about it, or there's something going on in your own life that you feel like you may be a diabetic. Certainly give me a call. I'm at 781-316-3405. Again, 781-316-3405. And that is Living Out Loud, and thank you for listening.